Hello, everyone from Boston. Let me start by thanking the organizers for inviting me to this event. It's a pleasure to be here with you, talking a little bit about this kind of trending topic, which is epidemic modeling that everybody's talking about right now. The objective of this talk is give you an idea about what is this thing that I call epidemic mathematical models and how we can use them to provide some assistance during this pandemic. I've been working with theoretical models for large-scale pandemics events for quite some time. And one of the most challenging things was to convince somebody that understanding how these events behave is critical to avoid the massive impact they have on society. That's why usually when I start explaining to an audience like you the importance of understanding epidemic spreading, I went to history books because it's something that already happened. Today, I don't need those examples to explain you the importance of epidemic modeling. I just need you to show you this slide. That's the current status of COVID-19 pandemic. Almost 70 million confirmed cases, and the number for sure is larger, maybe an order of magnitude, taking into account all the asymptomatics that hasn't been detected. And we have more than 1.5 million deaths, and almost all the countries across the globe has been affected. The numbers speak by themselves, and I'm sure that your life has been disrupted somehow during this year. Some factors make this pandemic especially dangerous. It is highly contagious, there is no cure, there was no vaccine, and till there is one now, but we still don't know how long it will take to vaccinate enough people to activate the herd immunity. And finally, there is no playbook to follow. There is no strategy that we can apply from the classical epidemiological books. That's why just at the beginning it went so fast out of hand. How we can help to fight COVID-19 until wait from a cure or vaccine? We can use mathematical models, and they provide a perfect arsenal to try to understand some of the things that they are going on and predict what is going to happen next. About mathematical models, I've always found this sentence from the 18th century's mathematician Daniel Bernoulli, particularly relevant regarding epidemic modeling. In a seminal article, he was trying to provide some tools to analyze smallpox mortality. He wrote the following: I simply wish that, in a matter which so closely concerns the well-being of the human race, no decision shall be made without all the knowledge which a little analysis and calculation can provide. A little analysis and calculation, and that's the essence of what we are trying to do. We don't plan to give a perfect description of the world, just some insights that help us to understand the underlying mechanics of these systems. And the perfect tools to do it can be found in the science of complex systems, where the modeling is a bottom-up process. We model the interactions between the main components, the individuals, and through that interaction, we observe the emergence of macroscopic behaviors. So that's from one side. Those are the models, how we can characterize the disease to include on a mathematical model. We can characterize the disease in many ways. For instance, we could look at the medical status and divide the disease stages into incubation and diseased. But here we are more interested in looking at the evolution of the infection status. The different steps depends on all the body reactions to the infection. When somebody gets infected, the virus starts replicating inside her body, increasing its number over time. It's what we call the viral load. At some point, the immune system starts to react, fighting the infection until the individuals, with a little bit of luck, recovers. This behavior helps us to characterize the disease into stages. These models were introduced more than a century ago, and they are based on the concept of splitting the disease stages into compartments. each having well-defined infectious properties. One of the advantages of these kind of models is that they are super flexible. We can use them to represent as best as we can a given disease, from the most simple ones, that, like these ones that are used to model some plant diseases, to more complex ones that have recurrent compartments like tuberculosis. Now that we know a little about an epidemic modeling, let's see how we use them to model the spreading of COVID-19. The first thing that you have to know about going from theoretical models to trying to model an ongoing pandemic, where you know a few about its properties, like what happens in March with COVID-19, it's like you are trying to build a plane while you are flying it. There are many unknowns that will affect the outcome of the model. We didn't have enough data to infer some of the epidemic parameters. We didn't know precisely how the virus transmits. At the moment, in March, the common consensus was that it was through droplets. Now we know that it's through aerosols, and it's essential that to take into account those limitations when you make predictions, and mostly when you propose new policies. As you can imagine, the model that we proposed, it's a compartmental model that at first glimpse may seem complicated because it has many compartments, but it isn't. We use this number of compartments because when you try to provide useful information to a policymaker, you need to show them the evolution of cases, which is related to the epidemiological dynamics, but you also need to provide them information about the number of deaths and the admissions in the ICU, and those are related to the patient's clinical evolution. We also divide the population in different age strata because the parameter that determines the transition between compartments are very different depending on the subject's age, especially those on the model's clinical side. And we include geographical information too, which is super important for modeling epidemic spreading, because the virus doesn't travel from one place to the other on its own. We carry it when we move from one location to another one. So we add recurrent mobility patterns to the model, and in that way we can describe the evolution of disease independently on each geographical locations that we consider. Almost done, right? What else we need? We need to include some parameters that are useful to propose some intervention policies. And in that stage, we focus on lockdowns and social distancing. Using those parameters, we are able to somehow play a little bit around and see which are the best policies to keep the spreading of the disease under some control. So how we use the model? Well, in the beginning, we use it mostly in Spain because we are from there, the leading groups are from there, and the data that we got at that moment was from Spain. In the case of Spain, I will say that we went through different stages. By the end of February, the beginning of March, I think that it's safe to say that our government was in denial. They told us that there were individual cases, that everything was under control, that the only thing that we should do was wash our hands and keep some distance. But obviously, that wasn't true. Just looking at what happens to Italy some weeks before, you knew what would happen in Spain. At the beginning, what we did using an early version of this model was provide a 5 days prediction of the evolution of the risk of having COVID-infected individual on each of these 6,000 municipalities. Our intention was purely informative here. We tried to let the people know where the hotspots of the infection were to minimize their exposure. And what we did was make those predictions available through a web page where you can enter and check how's the situation in your municipality. We did it without any help from the government, which at that moment didn't share any kind of data, even after asking for several times. All the data that we used to build it was manually added to the database of cases, tracking all the individual cases reported by the press. Obviously, to the exponential growth of the epidemic, we had to stop updating the web page in the mid-March because it's impossible to keep adding manually all those cases, which by that moment were a huge number. I would say that the model was quite successful, and the press started to reporting news based on our predictions. We even expanded the model to Portugal and Brazil at some point, thanks to some fantastic collaborators there that handle all the process of data acquisition for us. And the next stage, by March 14, it was evident that the pandemic was completely out of control, and the government finally reacted. On that day, they announced that they will impose a partial lockdown that will affect all non-working mobility. That basically means that you have to stay at home unless you have to go to work, regardless of the kind of work you are doing. We did our math, and that decision supposed an estimated reduction of between 60 and 65% of everyday's mobility. And according to our model, that wasn't enough. We needed to go further and impose a total lockdown, just allowing the mobility of essential workers to avoid the healthcare system's collapse. You have to take an essential thing into account when you try to minimize the effect of COVID, the healthcare system capacity. It's imperative to keep the severe cases below this threshold. Otherwise, the system will collapse. And that's, I'm pretty sure that you heard many times this concept of flattering the curve. And the flattering the curve have this objective of keeping the number of cases below this threshold. Those are the predictions that we did using our model. In red, you have what would happen without any restriction. In orange, what would happen if we continue with the partial lockdown. And in green, what we should expect if we apply, as we proposed, the total lockdown. As you can see, there is a significant difference. And even if it seems that the partial lockdown will borderline the threshold, when you look at the region's data, you will see that some of the Spain's administrative divisions are far above their healthcare system capacity. We were extremely concerned about this. That's why we sent a letter to The Lancet, subscribed by more than 60 top scientists, with the hope that the government will react and impose a total lockdown. It is hard to say if we succeed, if they take our letter into account, but a few days after the publication of the letter, the government at some point finally decided to impose a total lockdown on Spain's population. After that, we update the model with the data that the government has finally started to share. We use this data to make our model more robust and more accurate in its predictions. For instance, look at how well our model predicts the evolution of cases and deaths. And even more, we have an excellent prediction of how the instances of COVID spatially distribute over the territory. As the number of cases and deaths was reducing, it was time to think about what's next. What are the best options to avoid a second outbreak? And that was relatively easy to see at that moment. Social distancing, masks, avoid gatherings, keep a high percentage of people working from home, and start doing an intelligent contact tracing strategy. It's something that you only can do when you keep the number of cases below a given number. That was what we discussed with some government officials. However, as summer got closer, they decided to proceed with a speedy reopening in an attempt to save the summer season, one of our largest sources of income. It was evident that it wouldn't be possible to save the season. Nevertheless, they enter again in a delusion state where the new normality that they proposed was almost the old normality that we got. We made our prediction, and it shows that if the restrictions were removed as they were in mid-May, and if they didn't implement enough measures of tracing, a second surge was almost inevitable. And that was what happened. Our summer season was a complete failure, and our second outbreak was one of the largest in Europe. And that's a critical lesson that we have to learn from this crisis. We cannot release the brake that in the case of epidemic spreading is the lockdown without having a detailed plan of keeping the cases on a manageable number. As a summary, let me mention some other insights that we learned through this process. First, for those of you that are interested in modeling, 2 pieces of advice. Keep your model simple at the parameters that you need or that you think you need to model the spreading, but keep it simple. Anything else, if they are simple, they are more understandable and less dependent to external sources. Second one, be transparent. Be aware of your model limitations and let the others be aware of them too. If you enter in our webpage, you will see a disclaimer explaining what you can and cannot expect from our model. That's super important for policymakers to know before they apply any possible decision based on your model. For those of you that are on the opposite side and it's your duty to make decisions, let me tell you that data is everything. The model's predictions are as good as the data that we use to calibrate them. We need a common strategy to deal with public data, always respecting privacy, that's for sure, but we need that strategy. Still, the governments have to start thinking that good and curated public data is the best investment for social advance. And we are still very far from that point. And as before, try to be transparent. Governments have to start dealing with the citizens as adults capable of understanding facts. They have to stop shading reality, because at the end, the cold and brutal reality will prevail. If governments give us all the details available, we will make our best educated guess and act accordingly. That's super important that the governments do that. Finally, if you are interested in our model's technical details, you can find the link to the paper which has been accepted on PRX and the code needed to reproduce it in this link. And please let me acknowledge all the authors and contributors that somehow have contributed to this work. It wouldn't be possible without them to achieve some of the things that we did during this almost a year. And that's all. It has been a really pleasure to be here, and thank you very much for your attention.